Hello, everyone, and welcome back to another week of Bulletproof Hygiene. Brittany and I are so grateful that you are joining us and spending your time investing in yourself and moving forward in your profession. And we always want to hear back from you. So please, please, please don't hesitate to leave us some comments or reach out to us on our Mighty Networks app. Today, we are going to be talking about getting our patients to yes. Really helping our patients own their condition so that they will enroll in their health and what they need and what our recommendations are for them. And so I know we spend so much of our day communicating with patients toward the end goal of helping them move forward toward health. And so we want to talk about how do we get our patients to fully own and embrace their conditions and understand the treatment options that are available to them so that they can say yes to their health. And there's so much that goes into the operatory. And though we won't be able to delve into every aspect of that today, we'd like to lay a good foundation for moving the needle forward and creating better enrollment for both the patient and the practice health. So Brittany, take us away with some of the basics of communication.
All right, so some of the basics of communication are communication has power. But like any powerful tool, it needs to be used effectively, or it can actually cause us self-inflicted harm. And harnessing the power of communication is a fundamental leadership discipline. So it's a discipline. So it's a learned skill. It's a honed skill. It's something that can be refined and constantly developed. And I think that it needs to be. Communication, like most other things in life, is always evolving. It's constantly evolving. And it has a lot to do with how each of us grew up, our own experiences, our own biases, our own beliefs, our own come-froms. There's a lot of aspects of communication that we need to consider if we want to do it effectively. And effective communication is, I think, one of the probably the most common thing that's found amongst the most successful people, no matter which aspect of business they're in or medicine, which industry they're in. I think effective communication just is maybe the most important tool to have in life to be effective and have good relationships with others.
Yeah, and I want to say on that front that, not everybody is a natural born super effective communicator. And so we're always talking about what our mindsets are on these things. I think it's important that we don't get locked in and think, well, I'm not really great at that. I'm quiet. I'm more quiet, or I'm more shy, and it's just not my thing. I don't connect with people as well. I think that's more of a fixed mindset of thinking I can't do this, instead of thinking, you know what, I'm going to figure this out. And just like you're saying, I think it takes practice, and we practice hygiene, and we're doing it over and over and over, and we're learning and we're growing and we're stretching ourselves. I think we have to do this in the umbrella of communication as well. And sometimes that's even just role playing with our team and other hygienists and assistants and doctors, and practicing until you really build that confidence and feel better about what you're doing. And obviously being really intentional in how you're doing it.
Yeah, and I have some personal insight that I can add on this topic. And I think that, I have said before in some of our previous podcasts, like I don't consider myself to be a natural born good communicator. Like, it's something that I've really had to work on, really had to practice, and really had to hone and read books on, and, watch myself in the mirror, or, repeating certain things like I know that you've shared, that you've done, practicing your verbiage so that it's authentic and what you truly believe and based on your resounding why. But I had an experience that I think will, help people to understand really how much of a skill this is. Like, it's not just like a gift. It's not something that everyone's born with. And the more we think of this as something that can be developed and learned and practiced, the more open I think we are to doing this imperfectly and continuing to grow and get better. So I was homeschooled in middle school and high school, and that enabled me to graduate when I was 15 years old, right? So I was a very young graduate. My older sister and I enrolled in just community college. We had early admitted, right? So one of the first classes that we took as 15 and 16-year-olds was a speech class. And in the speech class, we had to give a presentation that used a demonstration. So it was a demonstrative presentation, like explaining how to do something from start to finish, giving instructions. And, the teacher, this is community college, it's very entry level, it's a prerequisite class. So it wasn't very, very advanced. It was very basic, but I, as a homeschooler, had never had the opportunity to give a presentation to a class or to public speak at all. So this was really my first public speaking opportunity. And it was in front of, college kids who were older than me and smarter than me and had more life experience. So it was already like a nerve-wracking thing for me.
Sure.
But so I did my presentation on something art related. I was taking art classes at the time, and I was explaining how to create this really simple like piece of art. And all I remember is when I finished this, I think it was like a 5-minute presentation, the teacher immediately said, "Well, you're going to have to do that again." That was her immediate feedback to me. So I was immediately like shot down, totally humiliated, embarrassed. And I remember some of the things that I did in that experience where I spoke really, really quickly, which is how I tend to talk, if I don't think about it actively. I spoke so quickly. I went through the instructions really quickly. I didn't really speak up. I didn't make eye contact. I didn't pause. I didn't ask questions. It was a lot of things that we do when we're entry level speakers or when we're inexperienced speakers, so I remember just being completely mortified. Like I went to my seat just so embarrassed that I actually left the class early. I left my things there. I left the class, and I remember stepping out and being so upset. I cried about it. I was so embarrassed and upset. My sister got my things and took them out of the class for me. Thank God. So I didn't have to go back. Right. So I had to give this presentation again. I had to redo it. Okay. So imagine I am shaking in my boots, having to redo the same presentation. And I just had to go back and read some of our public speaking book and get tips from some of the other classmates who were actually really encouraging. They were all older, but they were like, "Hey, you did great. You didn't feel bad. We all have had this experience. You're just really new at this. And this is what I recommend. And this is what I did. And this is how I practiced for this." And so I took their advice and ended up, I was given another opportunity to give the same speech, and then I did fine and I got a passing grade. But that experience just goes to show you, I'm by no means a great or perfect speaker. I'm still developing, still learning, but I've come a long way since that point to where now you and I, Charissa, have, we're speaking in a podcast and we do some public speaking and educating. And I've developed so much as a speaker, and I'm a lot more self-aware, but I think it's those pain points that sometimes enable us to become so much better at something or be willing to learn and grow and hone a skill. That was one of the worst and most memorable experiences of my life. And I could have just let it totally defeat me.
Right.
I could have just been like, "I suck at this. I'm terrible. I'm not trying again," and not stepped out ever again. And I was tempted to do that.
Yeah, I can understand that. But look at you now. Look at you.
Yeah, look at me now. Exactly.
So I think it's important when we are, we're having this conversation, and, the reality is we are talking all day long pretty much, right? To our patients, to our team. So I think it's important to kind of think ahead to what are our end goals here? What are we really trying to address? What do we want to become in the communication realm? We shouldn't really communicate something unless we know what we're trying to accomplish, because I think that comes across to patients and they're like, "What are you talking about?" We have to determine who matters in the conversation, and hopefully we're all going to agree on that's the patient, because that's all our big why. We're here to help our patients get healthy. So really communicating effectively with that patient so they can understand what's going on and make the best decisions for themselves is so important. I think a really important thing to think is, what do we need them to think, feel, know, or do in order to accomplish their goals? That's something to think about. I think just always putting yourself in somebody else's shoes with the person that you're trying to communicate with is a big, important step. And then what do they need to see us do, hear us say, or hear others say about this situation? I just think there's a lot to think about it. I want to make a really big point, because we say a lot, and verbal communication is a big part of how we're communicating. But we've got to realize that there's been a lot of research done on nonverbal communication. There's a lot of studies. It's a very complex topic, and there's been a lot of varying results from all of this. But most experts agree that nonverbal communication ranges between 70 to 93% of all communication. So what we're saying matters, but what we're doing physically matters even more. And so we've got to really pay attention to how we're presenting ourselves as clinicians, but at the same time, how the patient is presenting themselves. It's kind of like this two-sided coin, and there's a lot to think about here. And I just want to share, I've been very intentional with how I'm presenting myself. I'm making sure, I'm sitting straight, I'm, maintaining that eye contact. And it's almost a little distracting as I'm talking to the patient, because I'm like really thinking about, okay, how am I being perceived right now? What energy am I putting off? What are, am I coming across confidently? And my hope is that as I do this more and more, then it'll become something I don't even have to think about. It'll just happen.
Right. And I think this is kind of similar to verbiage, like how if it's practiced, you don't have to be focusing really on what you're saying because you've said it before and it's familiar. If you've practiced the stance, you're straight back and your eye contact, and you're facing the person, on the same level, knee to knee, eye to eye kind of thing. I think it does become more automatic, and it takes up less of our brain power to do it because it's something that's practiced. Right. So this is like one of the most important parts of communicating effectively is active listening. So instead of, preparing to retort or respond to what someone is saying, instead actually hearing what they're saying and then pausing and formulating an answer is a lot more, effective. And the more that we have practiced what our standardized answers will be, and of course it's not going to be the same for every patient, but there will be similar answers for similar problems, the less we have to sit there thinking about what our answer is going to be, because we already know, and we can truly, well, we know to some extent, right? And then we can truly listen to them and use what we've already practiced to answer effectively, and respond to what they're really saying, instead of just kind of sort of listening, trying to figure out what we're going to say and how we're going to potentially troubleshoot this or answer hard questions or solve hard problems.
Right. And it gets hard, right? I mean, when we have that shrinking hour and we know in our head, we've got to do this, and the patient's late and our next one's early. And like all this is kind of, in the background of our heads. Sometimes it gets really hard to just stop and listen and really listen. But that's where we really connect with one another, is when we're really giving each other that respect to listen and hear each other out. Because if you can really hear where someone's coming from, that's when you can turn around and meet the needs that they have.
Mm-hmm. Without taking it personally, I think, because the dangerous thing about, and I say dangerous kind of like I mean it, but not, it's dangerous to us if we are in an emotional state of, I'm taking this personally, what this person is saying, and I'm taking on their feelings and their perspective. Even if it's not the way that I view the situation, but we don't have to do that. We can listen effectively and non-judgmentally and with detachment to be able to actually solve the person's problem without taking their, pushback when we deliver sensitive information as something that's personal. Instead we can come from, I sincerely want to help you solve this problem. I will do whatever's in my power. I will get answers from others if I don't have the answer, and we can work together to do this, instead of like taking it as a personal affront when someone doesn't immediately accept the information that they're being given to,
So I think one of the most important things that we as clinicians need to do is come across very confidently. Our patients are coming to us for our expertise, for our advice, for our treatment, for our care of them. And they clearly are coming to us because they don't know all of the things we know. They didn't go to school. They didn't learn all these things. So they're coming to us for our professionalism and our confidence in what we can provide them. And I feel like there's no better way to communicate that than eye contact and really looking directly at the patient. It brings that connection. And it also, honestly, if we're not looking right at the patient, then we can't really read their facial cues as to, what they're feeling about what we're saying. So I think that's really important. Facial expressions are a big deal. So, if you notice that your patients are kind of squinting, that can indicate that they're confused. Maybe they're really trying to understand. They're kind of in deep thought over it. If their eyes are wide and they're looking, they've got that eye contact with you, that shows that they're interested in what you're saying. Mm-hmm. If you've got somebody who's got kind of the furrowed brows and, that can mean they're irritated, they're concerned. And obviously we know if somebody's kind of rolling their eyes around and, looking off to the side, that they may not be trusting what you're saying. They may be a little frustrated. Obviously people that are smiling are pretty happy that, they've got a good connection with you. They've got some joy going, but it's really important to read and kind of see where that patient's at throughout the appointment. and not just skip over it, not just think, oh gosh, they're frustrated. That's when you want to check in with them and say, hey, tell me how you're feeling about this. What are your thoughts on this? What questions do you have right now? So much of communication for me with the patient is really reading where they're at and catering to that. I mean, I tell my patients all the time, I work for you. I'm here for you. We're going to do this your way. I'm going to give you my professional advice and guidance. You get to make the choices because it's your mouth. So I think, learning to read them so that you can really connect with them is really, really important. If you notice that your patient's kind of looking away during the conversation or avoiding eye contact, that can either mean that they're disinterested, or it could just mean that they're shy or kind of fearful about the situation. I find that if people are looking at other things, like if they're just watching other people, or if they're looking at their watch or looking at their phone, that feels more like a disinterest kind of thing. But if you've got somebody who's looking more like kind of down or, just kind of staring at objects, a lot of times that is anxiety and fear. And that's, again, when you can check in and say, hey, tell me how you're feeling about this. What can I do different to make you comfortable?
Yeah, I think that all these are really important social cues and good things to be aware of. And also, I think it's important on the same note not to infer what the patient is thinking. And it is important, like you're saying, to ask and clarify, because a person might be, looking away from you or whatever, and they may just be distracted, or they may have ADHD, or they may, have autism or be on the spectrum, or you know what I mean? So it may be something else. They may have questions, or it may just be like their demeanor, and that's a part of like getting to know our patients. But I think that the question asking and clarification points that you're saying, and the open-ended questions are the most important part of moving forward in any of those scenarios.
Right. I ask a lot during my appointment, how you doing? Everything good? How you feeling? Do you need anything? Because you're right. And it's especially hard with our new patients because we don't know them at all. So we don't know if they have certain habits or, what their normal cues are. So it is, and they don't know ours either. So it's kind of figuring each other out at the beginning and just leaving a lot of space and a lot of grace for that, I feel like.
Right.
I feel like body language is just so huge. And I think especially with, in dentistry, so many of our patients come in and they are nervous, they are fearful, they have phobia. And so I think physically being at the same level is really, really important, because obviously if you're standing over someone, that almost shows that you're kind of dominating over them. And if you're standing over them and they're already fearful about being there and talking to them about, treatments or things that they're going to have happen to them that aren't the best of news, that can be really intimidating and almost increase that level of anxiety. So when I bring my new patients in, we always go through their medical history, and I purposely sit knee to knee, eye to eye, right there at their level. I make sure I'm not sitting above them at all. Sometimes I'll even put them a little bit above me because I want them to know, like, hey, you're in control. But really good conversation. I purposely make sure I've got my legs crossed toward them. I don't have, my arms crossed. I'm open to what they're saying, and I'm trying to create that connection. And I think that's really, really important.
Yeah, I think so too. And like I have, one of the things that I think you and I really value is like what you just described, that like physical state of being on an equal playing field, So at my practice, one of the things that I love that was really important to Dr. Craig and our leadership team was the preclinical interview for new patients. So the preclinical interview happens when at the beginning of a new patient appointment. So an admin team member actually takes our patient back, takes the pano, and that's to establish rapport with an admin team member so that on the way out, if treatment is necessary, they've already built a relationship and rapport and established kind of familiarity with this person. So they're going to see a familiar face on the way out. So that's strategic as well, right? And it's all the little things regarding communication. So that's number one. But number two is after that initial hello and greeting and welcome to the practice and the panoramic, the patient's taken straight into a consult room where the hygienist then reviews the medical history on an eye-to-eye, face-to-face level in a private room with closed doors, so that we can talk about sensitive information, and I can relay to them like how important this information is, how it affects our overall trust, what we're going to do today. We review, the time expectations, like, hey, do you have any time frame limitations today so I can respect your time? But then also, I think one of the most important parts of this is then the doctor meets them in that position as well. The doctor comes in after I reviewed medical history, I repeat and relay relay all the information that the patient's already expressed to me, so the doctor doesn't have to go in and ask the same questions, but also then the doctor greets the patient on that even playing field as well. So their first interaction with me and the doctor is not them laid back in a chair, me expressing to them like, hey, open your mouth, be in this really vulnerable position. Then I'm going to give you really vulnerable information about your health and hope that you're okay with it, you know?
Right.
So that physical stature, I think, is really important in the patient just feeling safe and feeling like they are in control and earning their trust early on in the appointment. So I love that you guys implement that, and it's such a big part of what you do as well.
Right. And what you're saying, I agree with, and I think is very important that we, even if it's not a new patient and we're not, going through the whole medical history, big review, even just when I bring my patient into the operatory, I think being physically present right in front of them, it shows that you're interested in them. It gives them, it's respectful, and it shows that you care. And I say that because I know because I do this daily with all the rest of you, that there's so much happening in hygiene. We got to get that note entered, and I drop that template so I can start putting all the things in, and I'm trying to put in what they're telling me as we're going. And it's easy to like do it all from behind them, right? It's easier, it's easy to be back at your computer saying, hey, have you had any medical changes? Hey, let's go, Right. But I think that loses a lot of that establishing trust and communication. Mm-hmm. So what I try to do is, when I first meet my patient, I'm standing in front of them and I'm saying, hey, how are you? What's been going on? Tell me about life. And as they tell me that, I'll say, tell me, it's been 6 months since you were here. Have you had any medical changes, new medications, allergies, doctor's findings? What's going on that front? Anything dentally that you've been concerned about? Anything sensitive? Anything you've noticed? And then we always take blood pressure, and for blood pressure, I need them to be quiet for a minute. So that's the perfect time to, get the blood pressure going, and then step behind them and kind of drop in whatever they just told me to the notes. Mm-hmm. And I even clarify my patients, because, obviously the x-rays are kind of behind them at first too. So I'll say to my patient, because I don't want them to just think I'm back there not really listening to them, I'll say, hey, I'm going to just take a minute and look at your x-rays. And I'm very intentional with my timing. I'm trying then to actually just kind of talk about life things at that point.
Yeah.
I don't want to talk about clinical things while I'm behind their back and they can't see me. Because I've had this happen where, if you're in a rush and you're back there and you're trying to put things in, and you're trying to ask them questions, and you say, have you had any dental changes? And they're like, yeah, I've had some sensitivity, and they're pointing and you can't even see.
Right.
So I think just being physically present is really, really important, and it establishes you care, you are interested. I'm here for you.
Right.
I think that's important.
Those are great tips as well for managing your time while remaining present with the patient and communicating that you actually care. And sometimes, I think that we develop these strategies to effectively manage our time and stay on time and honor everyone's time, right? Because we have this shrinking hour, or even less than an hour in a lot of instances, right, to do a lot of things. But I think that it's important sometimes to step back and look and use our emotional intelligence to realize sometimes when it's just not, probably the tasks are less important than the communication in this particular instance. Like, it definitely involves experience and just kind of like awareness of what's going on in the appointment, because sometimes, even if it's not a new patient, like you're talking about, it could be a patient of record who's returning for their 20th time and you're there in a recare appointment. Sometimes we don't get done what we expect to get done. And a lot of that is based on effective communication, like listening for what's most important to the patient that day, right? So if they have a time restraint, for instance, like, okay, we may not be able to accomplish everything that I want to accomplish in this appointment. I'm going to honor your time and my time as much as possible to make that happen. But also there are like emotional scenarios, I feel like, where the patient isn't ready to have like a hygiene procedure. Like maybe they just need to talk about something regarding their health. Maybe they are not in a good emotional state to start scaling therapy or whatever, and just asking quality questions will help them to prepare and feel comfortable for when they return and have that done. And sometimes the communication aspect of that takes up a lot of the appointment, but it's what's the most important in establishing that we really care, that we're really listening, that we're really going to tailor this appointment to keep the patient as comfortable as possible, really give them the best treatment and the best value. Sometimes it's not about getting all the things done in that hour. Sometimes it's communicating effectively, really proactively and effectively listening to that person, and then either, finishing the hygiene if we can and if we have time, but sometimes rescheduling them for when they feel more comfortable or in an emotional state or a physical state where they're ready to have whatever treatment, especially after communicating sensitive information. I feel like sometimes people need to go home and process that. And we can't stay so task oriented and time oriented that we forget about the human in our chair.
Correct.
As much as it's important that we do stay on time to respect everyone's time, I think there are extenuating circumstances that sometimes don't allow us to get all the tasks done, and that's okay. And we can accept that. And a lot of times, those are the appointments like you and I have talked about before, where, we'll set the patient up and say, hey, this is a really important procedure. I need more time with you to complete this. And I want to spend that time with you. Just communicating that, allows them to know that you really care and you really want to do a good job. And also that you respect their time, you want to honor their time. And also we'll do this for you on a different day when we have that time to give you,
Right.
I think there are a lot of circumstances when communication is the most important part of the appointment. And then the rest kind of happens later.
Yeah. Yeah. And that builds trust for the future, because the patient knows, hey, you're going to really take care of me. I want to talk about a couple of body language signs that should kind of tip us off that maybe we need to change our approach. And what's interesting is these can either be happening on our part or the patient's part. So crossed arms, when we have our arms crossed, that can demonstrate a couple of things. That can either mean we're closed off or we're kind of defensive. So I've seen this happen, since I've been very mindful of this. I see patients when we start to talk about things, treatment that they need, or we're looking at photos together. I've seen patients kind of lean back and, and I recognize it. I'm like, okay, they're feeling uncomfortable. They're feeling a little defensive. I'm sharing some hard information. And that doesn't mean you don't share that and really communicate, but it's just important to kind of pay attention to that. I think it's also important though for us, because if we have our arms crossed, we almost seem like we're on guard or we're kind of closed off. So just being mindful of what we're doing with our bodies. If we see our patients kind of touching or rubbing their neck, I see a lot of men do this. Like when we start talking about the needs, that a lot of times can indicate, stress, discomfort. They say that when we kind of rub our neck like that, you'll see women kind of doing this, that it's kind of that subconscious, like soothing yourself. So a lot of times that can, if you see your patients doing that, that's kind of check in and say, how are you feeling about this? Do you have any questions? Posture obviously can signify confidence. So, I am trying, to make sure that I'm, my shoulders are upright, my head is up, I'm really looking at them, I'm really paying attention, because, if I'm sitting kind of slouched forward and I've got my head down, I don't seem very confident in what I'm communicating to the patient. Mm-hmm. And it's so important that the patients know, what you're talking about and that they can trust you. And then you said this earlier, and I know we both feel this way. Please do not ever have a conversation with a patient about what your findings are and what their needs are while they're laying back in the chair. Mm-hmm. You always want to be sitting them up, ideally looking at a screen with you of the things that you're talking about and that you're seeing, because that again takes you back to that mutual level of that relationship. I'm not over you telling you all these horrible things that I'm seeing and what we need to do about it. We're sitting up and we're just having a conversation. I know Brittany and I've talked about this before, but I think it's so huge to involve the patient in all of the experiences. You want to make sure that they are having as much sensation throughout the appointment. They're seeing the x-rays, they're touching the iTero scanner, moving that around. Yep. They're holding the mirror, watching as you're probing, they're seeing the bleeding. Even when patients kind of feel that discomfort as you're perio charting, if they've got some areas, of course you have those patients that say, well, of course it's bleeding, you're stabbing me, or it's hurting because you're stabbing me. And I explain to them, but do you see when I go right here and it doesn't hurt at all? That's because this area is healthy. Mm-hmm. So it's actually educating that patient, helping them understand why what they're feeling is problematic. It could be sensitivity where there's an area of decay. Really helping them kind of put all that together, I think, is important.
Right. And explaining, I think that's a great indicator too, like when the patient has physical sensitivity. Of course, that's not our goal. That's not why we're probing, right? It just happens when there's infection. So the people are like, well, yeah, you just poked my gums. I like to say, I'm actually taking this little measuring tool. And when gums are healthy, when I'm taking these measurements, it should feel like I'm touching your gums, but it shouldn't be uncomfortable or painful. I liken it to when you wash your hands and the skin is healthy on your hands. Washing your hands doesn't hurt, but when you wash your hands and there's a cut there, it's uncomfortable. So I'm measuring into a wound right now. In the future, I won't be measuring into a wound. I'll be measuring into healthy gums once we solve this problem, and it'll be a lot more comfortable.
Yes.
And at a future appointment, I just recently had a patient do this where she was pregnant, had her baby, she had a history of periodontitis and treatment of active disease. And then I educated her throughout pregnancy. She also had an extensive treatment plan to be completed. So after pregnancy, she had her baby, took new x-rays, did a new comp perio chart, educated her. She needed to be scaled again. So we did scaling. And then she began using Perio Protect. And after a few months of doing that, we kept reevaluating. And she was like, she's like, are you just being really gentle today? And I'm like, no, I'm doing the exact same thing as we did at prior point. It's just your gums are so happy today and healthy that this is what it feels like. I'm just touching your gums with this measuring tool. And there was just infection present before. So it was uncomfortable for you. And she was like amazed. She was like, I can't believe this. It's incredible. I can feel the difference in my gums. I'm so proud of myself. I'm so happy. So it's really cool when you take the time to explain that part, especially, and then patients get to see it on the back end. It's just an awesome thing.
A total win. Win.
Mm-hmm.
So when we just talked a lot about nonverbal communication. So I want to switch over and talk about verbal communication. And in all honesty, if we're going to move people, we've got to meet them where they are. The bigger the gulf between us and them, the less likely it is that it's effective communication. So I want to start with talking about the tone that we use, because I think that's really, really important. Mm-hmm. We want to be sure that we're coming across as informative and educational and professional, but at the same time, compassionate and empathetic and understanding. And like I said earlier, as a guide to them. Mm-hmm. And, I know you and I both really believe in trying to mirror and match where that patient is at. It's what I just said. It's kind of shrinking that gulf between that us and them and coming together. And I think mirroring and matching our patients is the way to do that. And, the tone that you use, the vibe, I try to match that up with the patient. If I've got a patient that, seems to be a little quieter, a little more meek and not, real boisterous, then I will lower my tone to kind of match that. If I've got somebody who, is real gregarious and fun and loud, I'm going to match that, because that's going to kind of bring us together and take us onto the same level.
Yeah. And what's really cool about mirroring and matching and tone of voice and likening our stance and our the way that we're sitting and the way that we're talking and the speed at which we're talking to the way that the patient talks and the way the patient is sitting, is that people tend to like people who are like them, right? So it's a way to build rapport subconsciously, even when this is like the first impression that the patient is getting or one of the first interactions that you're ever having with them.
Right.
So this is like a really almost surefire way to build rapport and connection and have the patient think, I like her and I'm not really sure why, before they even really know you and before you even really know them. So this is one of the things that I'm so thankful to have learned and have had some training on at Spodak. We used to have like this culture immersion training, and it was about mirroring and matching and how to listen more effectively and how to build rapport with patients effectively. And this is one of the things that I feel kind of sets providers apart from one another. Like, can we do this effectively? And I can actually see a lot more readily now, and I'm sure that you can too, when this is going well and when it's not going so well from the outside looking in. Like when we watch another provider doing this effectively, it's like, oh my God, it's like a symphony. It's a beautiful thing to watch. You can see the connection happening. You can see the patient kind of leaning in and feeling more comfortable and kind of trusting this person, and conversely, when it's not happening effectively, or when there is a patient who's super gregarious and a provider comes in and is like, hello, how are you? Speaking in a completely like low voice and slow tone and like slow pace. And the patient's just like not connecting with that. Like, what is this? This is not familiar to me. Like, I don't know. They just see them as different and not relatable kind of, So it's really interesting to see how our relationships can develop just based on our physical stance and the tone that we use with the patient. So we want to mirror and match the kind of words that they're saying, how quickly they're talking, how they're sitting, if their arms are crossed, if they're sitting straight up, if they're kind of lower in the chair. I actually will lower myself in the chair. And then there's a way too, as we become more skillful at this, to kind of influence the patient to kind of feel a certain way, you know, when we're interacting with them like this. Like if a person comes in and is super, super aggressive or angry or just expressing a lot of emotions, like high intensity emotions, for instance, I can come in and meet them with that. Like I will speak loudly and I will speak more quickly, and then I will slowly change
Yes.
my tone so that they start matching me. And usually
Yeah.
that happens because when you go in and you build rapport with them initially by matching them, they're like, okay, this person understands, we're on the same page here, right? And then so that forms some small bond subconsciously, like, okay, this person gets it, you know, this person gets me. Then I start bringing my tone of voice down and having reasonable, you know, using different speech and slower tone. And then they usually start bringing theirs down to match mine because now I'm a relatable person that they kind of like for some reason. They're not sure why. You
Right.
know, it's interesting how you can do that. And of course, all of us have the choice as to whether or not we want to be influenced by someone else. So there are instances when someone absolutely is just in their emotional state. They don't
Right.
want to get out of it. You know, they won't be influenced. And that's okay. We all have that right as humans, you know. But I think it's a really important skill to have, and it makes us either effective or ineffective communicators in a big way.
Yeah. One thing you said earlier in your story when you were in speech class that I also think is easy for us to do in our crunched up hygiene time is to speak really quickly because we've got a lot to say and we're trying to get it all done. But again, if we're speaking too quickly, then a lot of times patients aren't getting it. You know, they're missing what they're saying. It's not resonating with them. It's feeling rushed to them. So I think just kind of paying attention to the speed that you're going at. You know, if you have a patient that is speaking more quickly, then I think you're safe there. But and a lot of times I will say, I find that patients speak very quickly if they're anxious.
Mm-hmm.
So, you know, that's one of the cues too, if you pick up on like, maybe, and just like you said, you kind of lead them into a different level of by speaking a little slower, then they can kind of take some breaths and calm down a little bit too. Um, and I just think matching their dental IQ is really important and their level of interest, because obviously if I have a patient, so it's funny, I do have a patient that I've taken care of for years, an older patient, he's an attorney, I love him. He does not want to know any clinical details. It freaks him out. He trusts us. He says, just don't even tell me what's going on. Just do what I need done. I'm good with it. I trust you guys. You know what you're doing. And then I have patients who I just saw a new patient actually yesterday who I was educating him on his conditions. And he said, I love this. I'm like one of those guys, like I actually majored in philosophy. So I love really understanding and, you know, asking a lot of questions. And so, you know, we talked for a long time about what was going on. So I think it's figuring out where that patient is on the dental IQ spectrum and meeting that need. You know, you don't want to go overboard and just keep talking about something. When a patient gets it, when a patient asks you, what do we need to do about this? You don't have to keep talking about the problem.
Right. And sometimes I think that we miss that. We
Yes.
don't really listen, and we miss the fact that the patient has already received and understood the
Yes.
information, and we keep explaining.
Yes.
Sometimes we explain the patient out of the treatment plan.
Yes.
They're like, you unsell the treatment that they already accepted because we just keep talking, you know, we just keep like, yeah, I get it. All right, I'm good, I'm done, you know.
Yep.
And what a gift is it? Like, I think sometimes we really undervalue or completely miss the gift that people give to us when they tell us what they want and how they want to be communicated with. Like the example of your attorney patient who said, I want no details, like just give me the big picture, like just do what you got to do. Like, fine, he just communicated with you. And I think our tendency as providers is we want to give the information, we want to educate, but the patient just said, I trust you, you know more than me in this instance, do what you got to do, I'm okay with it. So don't take the time in that instance to educate and fill him out on the small details, because it's just going to lead to frustration. He's told you how he wants to be communicated with. And I think this is a good time for us to kind of touch on when a person comes with a translator, or when a person comes with power of attorney, or when a child comes in with an adult. It's really, really important, and it's make or break rapport time, I think, when it comes to addressing the patient and not the translator, addressing the person and not the power of attorney, who's with them, or the guardian, or, you know, the parental guardian. So it's a learned skill and a practice skill to be able to ask the patient questions while interacting with the translator or interacting with the guardian, but still making the patient the hero while we remain the guide, right? So an
Really good.
example of this is I had a patient who came in. She was a new patient. She came with her husband. Her husband was born in the United States. His first language was English. She was born in Thailand, and her first language was Thai, right? So she spoke kind of broken English, pretty good English. Like I understood exactly what she was saying. Just she was a little bit slow. It took her a little bit of extra time to kind of understand what we were saying. She requested that her husband be in the room anytime I was explaining treatment indications or reviewing clinical findings. She was like, I just want to make sure that I understand. So I want you to call him in whenever we're ready to discuss this information. So this patient, had periodontal disease, hadn't been to a dentist in about 10 years. So I, needed to explain a lot of clinical findings with her and review the x-rays and review the perio chart and the photographs. So I asked her husband to come in, but the entire time that her husband was there, I was presenting both of them with the information, but I was sitting on her level, talking to her, letting him listen. And then I asked her if she had any questions, right? So she remained the center of attention and the center of the treatment, and the husband was just there as a supporting role. And I think that that's really important because that empowers the patient and makes them feel like, okay, even though this might not be your first language, like you are the center of my attention. I'm going to treat you with complete equality. You're an educated person. Like you're empowered to make this decision for yourself using whatever support you want to use. I'm not going to assume then that I'm just talking to her husband and he's going to make the decision. She didn't say that. She said she wanted him there for support. Right. So I'm giving her the information. When she wants to ask him a question, she can ask. And after, I'd answered all her questions, I did ask the husband, like, is there anything that you need clarification on? It seems like this patient, she seems very comfortable with it. Do you need to know anything else? He said no, but one thing that patient did for me too was she asked me to speak more slowly. She said, can you slow down? She's like, I think I understand what you're saying, but can you just slow down? That would help me a lot. And so that gave me an opportunity to slow down so that I could have a more direct conversation with her. So I think we need to listen for those cues. Yes. And sometimes, and not skip when the patient is telling you what they need or what they want. Don't ignore that just because we think something should be done a certain way.
Right, for sure. And I think it gets very easy for us to speak in our own dental jargon, just because that's kind of how our immediate go-to in our brains. And I think, a good idea is a team. I know we've had some listeners reach out to me and say, hey, I'm really, we're digging the podcast. We're loving what we're hearing. We're actually listening together as a team. So if I'm talking to those of you that are doing that, it might be a really good idea one day to sit around and come up with some kind of analogies that you guys can all use together for dental issues. Because it's really important that we make the patient's condition relatable and understandable to them. Just a simple example that I use, we're seeing a lot of patients with a lot of recession and abfraction and occlusal wear. And, trying to explain occlusal trauma to a patient is really difficult. They can't put the two and two together of how the teeth meeting together is contributing to the gums dropping at the gum line and that those areas ditching out. It just doesn't always make sense. So one of the things we talk about is we say, it's kind of like when you put a fence post in the ground and you've got it planted really, really solidly there. And then you come up to the top of that fence post and you really put a lot of pressure straight down and just gently kind of move that around. What happens to the ground around that fence post? Mm-hmm. It dissipates. It starts to dissolve away and disappear. Mm-hmm. It's the same thing that's happening in your mouth. Your teeth are rooted strongly in the bone. And if we're putting these excess forces and moving that around at the same time, it starts to cause that bone to dissipate and disappear. The gum lays on top of the bone. So where the bone goes, the gum follows. So it's one of those, a lot of times it's like that aha moment of, oh my gosh, that makes sense to me.
Right.
But it's communicating all of these, crazy things that we have to talk about all day between perio and decay and, why an onlay is a good restoration and, why we use crowns and all that to really explain to patients so that they can relate and understand and are able to really get it so they can make the best decisions.
Right. I love the, that you use this for anyone watching on YouTube. Charissa physically,
without physically.
Showing what she does, because Charissa, this is what I do. I show patients this is what your teeth do when you clench and grind and you sleep, you know, like, and I use both of my hands and I say it flexes at the neck of the tooth.
Right. Yep.
It's important that we listen for what patients want in regards to this too, because I think that, I think the way that I learn and hear things and want to receive information is probably uncommon, not in a good or bad way, just uncommon. Like I want to receive tell me like what is happening with the gum and the bone, because there's a lot of patients who, there's one doctor who comes in and explains, having no attached gingiva or no keratinized gingiva around a tooth as, the sleeve around my arm and around my hand. And, this is the loose cuff and it should be tight like this. And she just explains using the sleeve of her jacket, and it's very effective for some listeners. And to me, I'm like, why did we just take the long way around? Like, just tell me what's happening in the gum and the bone. Like, why are we using parables? But so many people understand that more. So again, it's just listening for what the patient wants and needs, and a lot of times using what you just did, what I love that you just did is you used something verbal. You were explaining the fence post thing, and then you showed them with your hand, you showed them as well. So they were hearing what you were saying and they were seeing like a physical example of like what you meant by that. And that goes back to engaging more of the patient's senses. So the more the patient's senses are engaged in the more ways that we get them to interact or experience what we're telling them or what we're educating them about, or the solution that we're recommending, the more likely they are to understand and accept the problem and the possible solutions, and to actually say yes to and choose something. So in regards to perio disease, showing them their x-ray, their perio chart, the tooth in their mouth, a photograph of gum recession, having them listen to you educate them about periodontal disease, and then having them touch a perioprotect model or touch a physical model of a tooth or something. The more they can put together all the pieces of the puzzle, the more likely they are to move forward and accept their problem and the solution.
Yeah, absolutely. I think you said this earlier, and I absolutely agree with you, of course, is listening is the biggest key, I think, to communication. So I think it's really important that our goal is that we listen more than we speak. And, a lot of times our patients don't even know what to ask or what to say. So I think, asking those open-ended questions and inviting questions frequently is really important, because you've got to give that patient the space to have those questions and to, think it through. We want to be talking more about their conditions than either your or their personal life, because I think, a lot of times we'll fall into that trap of, obviously we want to connect with the patient. That's the fun part of having all the, like what's happening in life, and, let's celebrate that and let's talk about that. But if that's taking precedent over really talking about what's happening in their mouths, then we need to back off of that. And it needs to be more about what's happening clinically.
Mm-hmm.
I know you and I both are big fans of the pause. Sharing the information, showing them what's going on, educating them, and then pausing to let them kind of take it all in and think it through, and then ask questions. And that's really hard for us as providers, because a lot of times that quiet space feels really uncomfortable, right? Because I think we get a little overwhelmed, because we know that what we're sharing may not be the best news for them. And we feel uncomfortable about that. And so we talk our way about what's happening. And then if it gets quiet, we feel really uncomfortable, because we think, we start like running it through the me filter of, oh my gosh, are they angry? Do they not like this? What's happening? I don't know how to feel about this. And so we immediately start talking again. Right. But that pause is so important for them to really take the time to absorb everything you've just said.
Yeah. And I think having no expectations for the pause too, because that can go any way, shape, or form. If you pause and they don't immediately fill in the pause with a question or with saying something or doing something, like the next thing, 5 seconds later, which may feel like an eternity, might be like, okay, well, let's do it. Or it may be, I don't understand this. Can you explain this differently? Or it may be, they're upset about something or they're unsure, but at least gives the opportunity for them to finish whatever they're trying to process at that moment, as you're giving them so much information, and then giving them space to really experience whatever they have to experience, even if it's a negative emotion or a challenging emotion, like really just give them space to own whatever that is. And then maybe if they're not breaking the silence or the pause, then maybe say, what questions do you have? How are you feeling right now? What are your thoughts on this? Like, then go, but I think the pause is important. And the pause is especially important after we've educated someone to yes. And I think that the pause after a yes to treatment, yes to understanding the problem, gives us an opportunity to reflect and say, okay, do I need to continue educating at this point? Or is this a just get going?
Right.
Should I start now? And instead of talking the patient out of the treatment that they've already accepted. So it can be a pause, allowing them to process something, or for you to process something, or for you to see where to go next.
And this is the part too, where we need to get very curious about what their goals are and what really matters to them, because we know what we're talking about. We know what's really going on. We know what things are going to look like in 5, 10, 15 years if they don't address this. But they may not know that. So that may be part of what we need to be sharing too. Hey, this is what's going to happen if we do take care of it. This would be our outcome. This is what's going to happen if we don't take care of it. Because we're working for them. So we've got to, when we give them all this information, that's when we check in and say, how is this sounding to you? What are your goals? Are you looking for a short-term goal here? Are you looking for a long-term goal? Where do we go from here? You get to drive the bus. And I think just giving them that space and asking those questions, you and I both are really big on always presenting what we think is the best treatment for them first. But I do like to give options, because I want patients to know, this is, I'm not just here to boss you around and make you do what I think. I'm here to give you all the options so that you can choose for yourself.
Right.
So, we've talked about this several times already, but allowing our patients to be active participants in the appointment and the assessments is really, really important. So you want to show and tell as much as possible. Take those pictures. And I know we as hygienists, the timing, we think, oh, I have to go get the camera and the card and load it. But it builds so much trust in your practice and in your professional providership.
Yeah. And as you like to say, it's 1,000 words. A picture is 1,000 words. So instead of explaining and taking 5 minutes to explain this thing, just pulling up a picture. So it may take, 3 minutes to go get the camera, snap the camera, snap the picture, upload the photo, but it's going to take the place of like 10 minutes of talking.
Right.
So it's like, we've kind of got to weigh the pros and cons.
Right.
And I want to touch on something that you just said, actually, about, listening for the patient, what their interests are, making sure we're addressing their concerns. Like, I think so a lot of times on medical histories, or when we're questioning the patient about their long-term dental goals, they may relay something to us that is, for instance, aesthetic in nature, right? They may say, oh, I want white teeth.
Right.
But when we get in there, we discover they have moderate perio disease and they have 3 cavities and they need a filling and 2 crowns or something, and they have treatment that needs to be done, and whitening now is on the back burner. Right. I think that the most effective communication happens when we can merge their wants with our wants. So our wants are to make them as healthy as possible, because we've got this different education and a different perspective than they do. We're the providers, we're the clinicians, and we're the ones who want to treat their disease to make sure that they're as healthy as possible. They may not see the value in that. They may not be able to see the cavity. They may not be able to feel the perio or feel the cavity at all, so they may not see the value in treating that. They may stick with their chief complaint of like, well, when can I whiten my teeth kind of thing, So as much as possible, I think educating the patient and trying to influence what they do value, so that maybe they develop to where they will value the health of their gums and their bone. Like you're saying, educating them about what will happen if we do nothing, what will happen if we treat this, what the treatment options are. Those things can all be tied in together. We can talk about the outcome of treating your perio disease is your teeth will look whiter. We may not even have to do a whitening procedure. Or the outcome of using these perio trays is your teeth will look whiter eventually, and we'll also treat your gum infection so that your teeth will look nicer over a longer period of time. You're less likely to have gum recession because of bone loss. These things often go hand in hand. So I think communicating in a way that allows the patient to understand that we value what they value, and that's important, but also they should value what we want for them, because it's going to help them achieve what they want,
Right.
And in some instances, maybe that's not possible, at least in the first appointment or first few appointments. And maybe some fires really do need to be put out before we start talking about those things. But we need to at least acknowledge, like, hey, we're going to come around. We're going to get to do the whitening procedure that you want. This is really important to me, that you get exactly what you want. And also that you don't lose teeth while we're waiting to achieve that goal. I want to make sure that you have this for a lifetime and come at it from both like a merged perspective.
Right. And how many times in your years of practice, have you had patients say things to you like, yeah, I had that root canal, or I had that crown, or, I had a deep cleaning, but I don't really know why I needed that.
Yeah.
Like, I have heard that so many times, and it's frustrating to me because I'm really big on educating my patients so they really understand what's happening. And that's where I feel like taking pictures comes in, because it builds so much trust. Because you can tell me that I have a cracked filling, but if it doesn't hurt and I don't feel it, I get a little skeptical. But if you can show it to me, all of a sudden it makes it very real. And I'm like, oh my gosh, that's in my mouth. What are we going to do about this? So I think taking pictures, and even if it's just, a hand mirror, showing them in the hand mirror, letting them see for themselves, if they've got the red bleeding gums, showing them as much as you can so that they can experience it for themselves is really important. We actually had a new patient come in this last week, and we took photos, and he said, man, I knew it was bad, but I didn't know it was this bad. And it just brings the reality to what's really going on. You can't see in there yourself, so you don't really know. So I think pictures are everything.
So a lot of times in regards to photographs, if I sense, and sometimes it's easy to sense, like when someone is maybe like hesitant to accept information that you're giving them, or not as open to being educated, and they've got their goals in the forefront of their mind. Like, I just came in for a cleaning and I have to do all these x-rays and the photographs and all this stuff. Even after educating them about why we need all of that, I like to pop the photographs up on the screen in front of them before I even start talking.
Right.
A lot of times, because, and I'll just start clicking through, and I'll just sit there like I'm just looking at the photographs, and they're just looking with me, and we're just looking at stuff. And a lot of times they'll do exactly that. Like, oh my gosh, is that my mouth?
Yep.
Like, and then they get interested suddenly, so that can be a great tool to open a conversation when a person has their own like goals, and maybe they're a little bit detached at the beginning of the appointment about what you're saying, or the other important things, especially when, for us, our new patient appointments are 90 minutes. It involves a lot of diagnostics and simple hygiene when there's time. So like, we'll do a prophy or a perio maintenance if we are able to at the end of all the diagnostics. But before that, we'll do FMX photographs, 3D wellness scan, comp perio chart, comprehensive oral eval with the dentist and with the hygienist, oral cancer screening, all that stuff. And some patients, we'll explain to them that all this is going to happen and the reasons why. But some of them are hemming and hawing, and they're like, I just came in for a cleaning, and I just, and when am I going to get my checkup and that sort of thing. And as soon as I'm telling you, as soon as I swap those pictures over in front of them, they're like, oh, like complete change. So I think photographs can be very powerful for, changing people's perspectives and seeing the value of what we're doing too, and letting that be kind of the softening or the door opening in regards to talking about hard topics and other things.
And just like we're talking, it brings that ownership. Like, oh my gosh, that's my mouth. That's what's going on in there. I think, I've always chanted that patients being involved in their perio assessment, hearing those numbers being called out loud, hearing the bleeding points. I always sit my patient up afterwards and we look at the bite wings together, and I explain to them, each part of the radiograph that we're looking at, and how, this subgingival calculus that we can see, these, little barnacles on the side of the teeth, we can see the, the bone loss that's happened around those areas. I just think the more a patient can really get it, the more they can own it and move forward, and not just for treatment today, but for treatment down the road, long-term, understanding the big picture of it, because I think sometimes patients think, especially when we're talking about perio, oh, okay, I have an infection. And just like when we have a medical infection, oh, I have an infection, you're going to give me an antibiotic, and then I never have to deal with it again. Unfortunately, perio, that we know that's not the way that works. So I think they've got to know on the front end that, unfortunately, this is kind of a long haul, but I'm going to get you there, and we're going to do this together, kind of thing. I think it's really important for them to know that. So I'm going to lead into when we have to share the hard information. And let's be honest, what we're sharing is a loss in the patient's measure of health. Like that's a big deal. Obviously, thankfully, we're not sharing something like you have cancer. We don't, assuming, even if we see something on the oral cancer screening that we're concerned about, we typically are, saying, I want you to go see a specialist to get this checked out. But most of the things we're sharing aren't as devastating as that, but we're still sharing like, hey, this is less than what you were hoping to have. We've got to understand that empathy and understanding must always precede advice and problem solving. This is again where I think we've got to put ourselves in their shoes. How would I want to hear this? How would I want this presented to me? Wouldn't I want that person to be kind and empathetic? It gets easy to get in the rat race of your day and be like, yep, you have perio, when you do this, this, and this, are you ready? And that's not fair to them. They've got to own their situation before moving forward. And a lot of times, because these are hard things, that ownership can come with anger, frustration, denial, mistrust, and that's okay. We've all seen those patients who were giving them this information and they're like angry about it. Mm-hmm. And again, we need to not filter that through the me filter. It can seem like they're angry at us because we are the bearer of the bad news, but really they're angry that they're hearing something negative about themselves. Yeah. Something bad is happening to me. Right. And so I think it's really important that we meet that with the empathy and the compassion.
Well, and don't shoot the messenger is a common phrase for a reason, because we tend to want to attack the source of the bad news. It's just we're the easiest target, at that point in time. And sometimes it's a person's natural reaction when they receive hard news to just want to deflect or be in denial or just kind of bounce that hard news off of them and start blaming or get upset or angry. And that's a reasonable human response, but we have to remember, and that can feel really uncomfortable. It can be really difficult. And something that I struggle with personally is when I am taking all this time to do a really thorough evaluation, doing all this diagnostic stuff, practicing at the highest level of what we know to be the best practices and gold standards. And then someone saying, well, I don't believe you, or I need a second opinion, or having that angry response, because sometimes it feels like, why am I doing all of this? Why am I giving this patient the very best care if they're just going to blame me, or they're just going to lash out, or they're just going to be rude or mean? But I think that it's important, that no matter what, we are coming at them with empathy and complete honesty. And I think that sometimes when we get those negative reactions, or we encounter people who are angry about the information that we're giving them, or aren't immediately accepting, is we want to almost water it down. And it's important that we don't do that either. I think that, we want to lessen the blow, but kind of lessening the blow is not being honest about their current health status. So just like you say all the time, Charissa, don't say a little bit of bleeding, or, kind of inflamed, or a small crack, if that's not what it actually is. Don't let the fear of how a patient might respond or react be the reason why you don't tell them the whole truth. Right. So I think that people really underestimate and maybe undervalue too, being honest and transparent, because that is what builds trust over a long period of time. So even in that first visit, or in any visit, if I'm relaying hard information, the patient is going to know that in the future, when I give them good information, it's true to the best of my knowledge. I'm now telling you you're healthy. You can believe that completely. I was honest with you when this was hard information to deliver. Now I'm being completely honest with you when this is easy information to deliver. Right. So that consistent, honest, empathetic communication, I think, is what builds trust over time. And there, like we've mentioned so many times before, people have decisions to make. Adults get to make their own decisions. Is this the practice for them or not? Do they want to treat their disease or not? Are they angry or, hurt or sad or whatever about this information? People get to respond the way that they want to, but we can't let their response kind of change the information that we're delivering, because the truth in all the diagnostics and what all the diagnostics equal is what it is. We've got to relay that information to them. And like you say all the time, they come to us for our professionalism and our education and all the information that they didn't go to school for, so we have a responsibility to give them the news, even if it's hard news to handle, and then be with them and sit with them in their response, or if they need help or support in figuring it out, even if their response is anger or sadness, whatever, just making sure that we're there for them no matter what, where that conversation goes.
Yeah. And so I think, and I mean, let's just be super real. And I am very authentic with patients when we are having these hard conversations, and I'm telling them, let's just be real. If you're having a new patient come to you for the first time and you do all your assessments and you're telling them you have periodontal disease and it's, moderate to advanced and there's bone loss, and this is an incurable disease, and we've got a long road of maintenance ahead of us, and this is going to cost several $1,000s. Like, you're giving them all of this news, and obviously you're not delivering it in that way, but this is kind of the big picture of it. Like, do we really think they're going to smile and be like, I'm on board, let's go right now?
Right.
They've got to digest that, and they've got to absorb that. And sometimes that, that hurts them. And so I think the way to become empathetic through that is to just be real and say, hey, I know this isn't what you wanted to hear today. And in all honesty, it's not what I want to be telling you today. But what I can tell you is I know how to get this under control. I'm going to be with you step by step. We're going to figure out how to do this, according to your goals and on your timeline. You're not alone. And then if you've got a patient, this has happened before where I've had patients who get it. And they're like, okay, I get it. This sucks, but I get it. I need a little time to think about it. Absolutely. And, you got whatever your follow-up protocols are to follow up with them, but you never want to push somebody in or rush somebody into a decision when it's something big and hard like that. You want to give them a little space, but, just having that conversation of, hey, I know this is hard. Let's figure out a plan that works. And really listening, check in with them. Like, tell me what feels hardest about this for you. What are your fears in this? What are your concerns in this? And really, again, listening to those answers, because it may be just that they're really busy and they don't have a lot of time to come back. So let's figure out how to get it all done in one visit. Or maybe it's a financial thing. And so, okay, well, we're going to sit down, with one of our admin team, and we're going to figure out how to make this work for you financially. We've got some options. For some patients, it's, well, how is this going to hurt? Is this really going to be painful? Well, let's talk about, we have some options. We can do this under sedation. There's a lot of options there. So it's figuring out, after you share this information, what that patient is feeling and how you can make that, fit for them and be more comfortable in all of that.
Yeah. So this has been a super helpful review for me. I think that it's super effective and impactful and empowering to review this for anyone, no matter how long we've been in the game. I think it's important to remember that we are constantly delivering hard information and not lose that empathy and the weight of the information that we're giving to patients. And it's great to just review all of these tips about communicating effectively. And like you say all the time, iron sharpens iron. So I feel sharpened by this conversation. And we really hope that, everyone feels sharpened and like they've gathered a few gold nuggets out of this information and best communication practices for their daily hygiene regimens and interactions with people. Charissa, do you have any finishing thoughts?
I have one last thought.
Sure.
And that is, if you sense that your patient isn't owning it, they're just not getting it, don't make a treatment plan for them yet. Because that's almost like saying you didn't hear anything they just said to you. I would check in. Does this concern you? And if they say, no, I'm really not, it doesn't hurt me, I'm not really concerned. Okay, that's fair. I want to wait. I want to make sure we have more of your questions answered, or maybe I want to clarify what I said to you before, and, go back through the photos or go through. And if they're just not clicking, then, they may not be the best fit for your practice. What you really want to do is have patients say, what can I do about this? So if you've got somebody who's asking, what can I do? You're ready. Go ahead and make your treatment plan and make it fit for them. But, if we're just kind of bulldozing our way through and saying, this is the problem, this is what we see, this is the treatment plan, are you ready to move forward? That would really take anybody off guard. So it's really having them ask you, okay, what do we do about this? And then, you're ready to go.
Yep. That's a great tip too.
Yeah. Well, and I think, Brittany, this is the fun we get to do. We get, sometimes we have those difficult patients, and you and I are great about, we always share our days of what's going on. And sometimes we have those hard patients, and that feels frustrating. But I think more often than not, we really do get to connect with people and really help them be the hero of their health. And that, to me, is the most rewarding, fulfilling part of this career, this profession. So I think we're really blessed to do what we get to do.
Absolutely. I think it's an absolute honor. And how many times, how cool is it when you see an entire family and their kid graduates from high school and then graduates from college, and, you've got to see them through all of their hygiene stuff, through all the phases of life, and you get to know them over a long period of time. Like, I know that we've talked so many times about just the medical field, kind of their call to action for dentists and dental hygienists, because we get to see our patients more frequently for preventive care than anyone else. So what a privilege and honor is it that we get to see them just periodically, just to check in, just to give them a maintenance procedure, hopefully deliver good news, and sometimes not so great or hard news. But man, what a great experience seeing people develop and grow and go through the different stages and phases of life, and helping them through emotional issues and helping them through health issues, and just being there to hold their hand through all of that. Like, learning to communicate and just listening to them is just it's a true honor. It's a deep honor.
Yep, for sure. So I just want to encourage our listeners, if you want to talk a little more about this topic or have questions or share with us what's working so well for you so that we can learn it too, we would love that. Come join us on our Mighty Networks app, Bulletproof Hygiene. Just download Mighty Networks and search us on Bulletproof Hygiene. It's a really great community with lots of great questions and conversations. So come join us. We hope to see you soon.
Have a great week, everyone. Thanks for joining us.
Bye-bye.